Welcome to your course video lecture notes with Dr. Chandler. This lecture summarizes the research on biological and behavioral treatments for psychological disorders. Let's begin. Treatment approaches include the so-called insight or talking therapies of psychodynamic, humanistic, and cognitive treatments reviewed in another video lecture. The behavior therapies consist of token economy, behavior modification, systematic desensitization, and aversive conditioning that will be reviewed in this video lecture. Also, the biological, organic approaches state that mental disorders are diseases that are genetic and biochemical or neurological in origin. Basic biomedical approaches consist of drugs, also called psychotropic medications, the use of electroconvulsive therapy, and the use of surgery, sometimes called psychosurgery. This video will summarize these approaches. Finally, an eclectic approach to therapy is some combination of all of these approaches. Biomedical therapies include the use of medications or other medical treatments or physical interventions to relieve the symptoms associated with psychological disorders. The most common biomedical treatment is the use of medications. Those interested in pursuing a career in psychology are encouraged to take courses in psychopharmacology, which is the study of the effects of drugs on mind and behavior. The most widely used biomedical therapy involves the use of psychotropic drugs, usually prescription drugs, that alter mental functioning and alleviate psychological symptoms. Psychopharmacology is the scientific study of the effects of medication or drugs on mind and behavior, and how these medications alter perceptions, moods, and other aspects of psychological functioning. Drugs can be divided into 4 categories: antidepressant, mood stabilizing, antipsychotic, and anti-anxiety for psychological disorder treatment. Long-term risks of medication include side effects. For example, antipsychotics can cause tardive dyskinesia, the random repetitive movements that can be mild or physically disabling. As noted, psychotropic medications and other biomedical treatments can reduce the symptoms of psychological disorders. Psychotropic drugs work so well that their introduction in the 1950s led to the deinstitutionalization of thousands of people. Typically, a person is ready to leave the hospital after a few days or weeks, but many in crisis are released after just a few hours due to the high cost of treatment and financial pressures facing hospitals. The length of a hospital stay is often determined by what insurance will cover, rather than what a patient needs, as well as the severe shortage of available beds in psychiatric hospitals and units. Many psychiatric facilities cannot accommodate the numbers who need treatment. Since the 1950s, the rate of institutionalization has dramatically declined due to the availability of psychotropic medications. However, research on long-term effects of many treatments is still needed. All of the types of therapists shown here may specialize in the treatment of psychological disorders or be specially trained to work with specific populations. A number of states have passed legislation that allows psychologists to prescribe medication, not just the medical doctor. Previously, only a person with a graduate medical degree could prescribe medications. Such legislation is meant to address a shortage of psychiatrists, especially in rural areas. Several large-scale studies suggest comparable effectiveness between psychotherapy and biomedical therapies. Brain studies indicate that psychotherapeutic and biomedical treatments have similar effect on brain activity and neural processing. Research on psychotropic medication plus psychotherapy suggests that psychotropic drugs are most effective when used with psychotherapy. Combining medication with an integrative approach to psychotherapy, including cognitive, behavioral, and psychodynamic perspectives reduces major depressive symptoms faster than either approach alone. Due to this research evidence, clinicians are increasingly combining these therapies, supplementing the use of medication with different kinds of talk or insight therapy. Biomedical therapies include repetitive transcranial magnetic stimulation, or rTMS. In this treatment, electromagnetic coils are put on or above a person's head, directing a brief electrical current into a particular area of the brain. This treatment appears to be effective in treating symptoms of depression and some types of hallucinations. Another biomedical technique called deep brain stimulation involves implanting a device that supplies weak electrical stimulation to specific areas of the brain thought to be linked to depression. An X-ray image of a person undergoing deep brain stimulation reveals 2 electrodes implanted in the brain, one in each hemisphere. These electrodes send electrical impulses through certain neural networks, inducing changes that may lead to reduced symptoms. This treatment has produced promising results in patients with depression, but further research is needed to identify its long-term effects. Electroconvulsive therapy is a biomedical treatment for severe depression that has not responded to any other treatment. Electroshock induces seizures in the brain through electrical currents. Electroconvulsive therapy is used for suicidally depressed people who cannot wait for an antidepressant to take effect, or for those individuals that have not been helped by any other treatment. Just as with drug therapy, there are unpleasant side effects. For example, many antidepressants cause a person to experience a decrease in depression, but also a diminution of interest in sexual activity as well. With ECT, electroshock, a person loses the depression for some period of time, but also during that time they lose some portion of their memory for certain skills, such as their level of playing an instrument, knowing their way around their city, or cooking. So when a person takes antidepressants or electroshock, they must be suffering so much from the depression that these trade-offs with their unpleasant side effects are chosen over the depression. Neurosurgery is a biomedical therapy that involves the destruction of some portion of the brain or destruction of connections between different parts of the brain. In the past, the prefrontal lobotomy, which left people with altered personalities or unable to function independently, was viewed as a promising form of psychosurgery. Currently, neurosurgery includes the use of an electrode to zap a small area of the brain that is overactive for those with obsessive compulsive disorders who cannot function normally due to this overactivity, causing obsessions and compulsions to act over and over, say by washing their hands or checking the locks on their doors. Now we'll move on to behavioral therapies that use conditioning techniques. A classic study was John Watson's repeatedly exposing little Albert to a frightening bang every time he reached for a white rat, which led little Albert to develop an intense fear of white rats. The research concludes that emotional responses such as fear can be classically conditioned. Behavior modification draws on principles of operant conditioning, shaping behavior through reinforcement. Behavior modification uses positive and negative reinforcement and punishment, or sometimes observational learning, to increase adaptive behaviors and reduce those behaviors viewed as maladaptive. Behavioral records are used to track behaviors and reinforcement schedules to change behavior. Token economy uses positive reinforcement to encourage good behavior. Tokens give credits that can be exchanged for food, outings, freedoms, privileges such as TV, cigarettes, or other desirable things. Token economies are typically used in institutions such as schools, group homes, and prisons. Some believe this technique manipulates and humiliates with its assumption that whoever ever controls the environment, such as a prison guard controls those in that environment. Systematic desensitization is a step-by-step classical conditioning process where phobias are removed through gradual exposure to the feared object. Combinations of anxiety hierarchies with relaxation techniques often use progressive muscle relaxation, where a client practices relaxation techniques while engaging in situations listed on their hierarchy of situations that cause them anxiety. They begin with the least anxiety-provoking situation and, after repeated pairings, associating relaxation with the anxiety-evoking stimuli, such as a needle. In this way, the person learns to associate the anxiety-provoking stimuli with the desired conditioned response of feeling calm, not being fearful. This process is repeated for each step on their hierarchy of fears. During conditioning, two stimuli that produce incompatible responses of fear and calm are repeatedly paired. Because the responses are incompatible, one response will eventually be extinguished. Starting at the bottom of the hierarchy with the least anxiety-provoking situation allows the desired response of feeling calm to prevail. Exposure therapy is a behavioral technique of placing clients in feared situations, exposed to a stimulus, and forced to confront the fearful situation without any risk. When nothing bad happens, their anxiety diminishes and they are less likely to avoid the feared situations in the future. In this manner, extinction is used to eliminate learned fearful associations. In response prevention, a person is encouraged to confront a feared object or situation to prevent a fearful response. With these treatments, fear responses eventually diminish or disappear. This is important as phobias are commonly experienced psychological disorders that diminish functioning. The goal of flooding and exposure therapies, virtual or otherwise, are to reduce the fear response by exposing clients to situations they fear. Studies suggest that this method is effective for treating various phobias, including arachnophobia, a fear of spiders, and social phobia. Virtual reality exposure therapy is usually combined with other forms of therapy, and in the case of arachnophobia, this approach may be just as effective as regular exposure therapy or systematic desensitization. Nail biting and cigarette smoking are maladaptive behaviors commonly treated with behavior therapy. Behavioral therapies assume that these behaviors, sometimes called disordered behavior, are learned either through operant or classical conditioning. Behavioral treatments do not seek to gain insight into personality, only to measure the behavior and change the rewards and punishments which influence these problematic behaviors. This is operant conditioning. Processes that build new associations to disrupt unwanted panic and other automatic responses are examples of classical conditioning. Aversion therapy links problem behaviors to unpleasant physical reactions with the goal to cause the individual to have an involuntary, unpleasant physical reaction with the undesired behavior. Aversion therapy diminishes a behavior by linking it with an unpleasant reaction. Aversion therapy is used in addiction treatments. For example, smoking is associated with a bad taste and pictures of diseased lung tissue to decrease smoking. To reduce alcohol consumption, alcohol is consumed with a drug that causes nausea. Eventually, alcohol becomes a conditioned stimulus, prompting the unpleasant physical reaction on its own. In this manner, aversion therapy substitutes punishment for the positive reinforcer that keeps a habit going. In other words, conditioning techniques associate drinking with a bad taste and say pictures of a diseased liver to decrease drinking. Strengths of behavioral therapies include that these therapies work fast and change behavior, producing quick resolutions to stressful situations. These therapies are easily operationalized. Remember, this means measurable. And because they are fast, they have lower costs. Behavioral treatments cover a large range of treatment approaches, focusing on observable behaviors in the present. Weaknesses of behavioral therapies are that if the behavior is not a learned behavior, the treatments may not be effective. Also, newly learned behaviors may disappear when reinforcement stops. In this way, the focus on observable behavior may not address social, biological, and cognitive sources of psychological disorders. According to Albert Bandura, the major architect of social learning theory, SLT explains human behavior in terms of a continuous reciprocal interaction between cognitive factors, environmental influences, and behavioral factors. You can see how the social learning model incorporates personal factors of thoughts, expectations, and attitudes, and expands upon the behavior as a model that environment alone determines behavior. Social learning theory explains how we think and what factors determine our behavior. This three-way reciprocal relationship is presented in this model, showing how personal factors, environmental factors, and behavioral factors affect one another. In the application of social learning theory, the learner is encouraged to observe and imitate the behaviors of others, to see positive behaviors modeled and practiced, to increase their own capability and confidence to implement new skills, gain positive attitudes about implementing these new skills, and to experience support from their environment in order to use their new skills. Social learning models social skills training, role modeling, and practicing specific skills for use in real situations. There will be questions to complete following this video lecture.